So think about this. Itching has been a problem as long as there have been humans. You get itchy skin, and yet, despite all of our advances in science, there's not one FDA-approved therapy for itching. There are FDA-approved therapies for psoriasis, for eczema, for all sorts of conditions, but not specifically for itching. We call it pruritus as physicians. We like to give things a fancy name. No matter what you call it, it is extremely uncomfortable. It can actually be very difficult to treat. The standard therapies that we would advise somebody to use would be lotions and creams over the counter, maybe some anti-itch type creams over the counter, not FDA approved. Steroid creams like somebody would use for eczema are not FDA approved specifically for itching. Antihistamines are used for patients with hives or with allergies, but it's not actually FDA approved for itching. We actually have brand new studies coming into our office with new therapies that will help us understand how they work for patients who itch. So the first thing to remember if you're a person who has problems with chronic itching is you're not alone. There are therapies on the horizon. There are therapies that we can use now that help some. You should be evaluated for allergic conditions, skin or dermatologic conditions. Some patients with neurologic, hematologic, and psychological issues may have issues with itching. It can also be a side effect of medications you're on. So it's an exciting time, actually, what's going on in the land of patients who suffer with itching or pruritus. Every patient's insurance plan is a little different. I feel like most patients currently are able to self-refer into the office, but you want to cover that with your insurance plan first. If you have problems with allergy or itching or asthma, the standard protocol is to schedule an appointment up front. If it comes through a referral, we'll reach out to you directly. Once you're in the office, we'll do an evaluation for pertinent, important allergy triggers with the standard skin test. If it's indicated, we might consider a laboratory evaluation. Everything starts with the history. When did the itching start? When did the allergy start? What are the triggers you already are aware of? We're going to review your past medical history and the medications you're on to be sure that's not complicating some of these problems. Many of the patients we see here were able to identify environmental allergy triggers. And the number one therapy for environmental allergies is to avoid it. Now, if you're a person who likes to ride a mountain bike or go for a hike, tree, grass, and weed pollen allergy could be a problem. So we'll work with them towards a medication plan with the least amount of side effects and the most benefit to try and help them through that. And of course, there's the option of getting allergy shots, which in the long term will help their body start to block these allergic reactions. Yeah, I mean, within 6 to 12 months of starting allergy shots, about 90% of patients are able to stop using their medicines or reduce their total amount of medicines. So it's a very effective therapy. It's more like training for a marathon, though. You have to buy into, the regular administration of the allergy shots, and over time, it will decrease your sensitivity to those triggers.